While as South Carolinians are preparing to travel and gather for the holidays, health officials are tracking rising COVID and flu cases along with a growing measles outbreak, which is happening over in the upstate. News 19's Jamin Wade is showing us what doctors want families to know ahead of those holiday celebrations.
Doctors across South Carolina say they are seeing a rise in COVID and flu as winter arrives. Emergency rooms are busy and physicians say many respiratory illnesses look the same at first.
COVID, flu, RSV, these are common respiratory illnesses that present in very similar ways. Cough, runny nose, sore throat, body aches. You can also have vomiting and diarrhea.
South Carolina reported more than 1,000 flu cases last week, and hospitals are also seeing more patients testing positive for COVID. Dr. Jared Stone with Lexington Health expects both viruses to continue rising as people travel and gather with family.
It's really important to try to prevent the spread, especially this time of year. We're already seeing plenty of cases, not just of COVID and flu, but a number of other respiratory illnesses.
Families tell us they are doing what they can to avoid bringing COVID or flu into holiday gatherings.
We make sure we wash our hands. We keep the sanitizer handy. We limit hugs, kisses, especially with a newborn, well, infant rather. But yeah.
Others say they've had respiratory illnesses before and aren't too worried this year.
It's not a major concern of ours that, we've had it and it's more like a cold.
Yeah, more so the COVID than the flu. But for him, he's up to date on his shots, but we're not so concerned about it.
Some South Carolinians say immunizations and basic precautions help them feel more prepared around family.
Just wash your hands and make sure you're a little cautious when you're seasoning the foods and handling foods as well.
Meanwhile, in the upstate, the measles outbreak has now reached more than 140 cases and have led to hundreds of students being quarantined. Dr. Linda Bell warns that measles is much more contagious than COVID or flu.
What we recognize specifically with measles is that high vaccination coverage is really, really important because this is one of the most infectious viruses known.
State health officials say measles can spread before a person even realizes they are sick. They are urging families to pay attention to any new symptoms and reminding people that vaccination is the best protection against this outbreak. DPH urges anyone that's been exposed to measles to call ahead before visiting a doctor. As for COVID and flu, doctors recommend getting vaccinated, washing your hand, and avoiding crowded spaces when you are sick. Flu season usually peaks in January or February, so it's not too late to get vaccinated. Reporting throughout the Midlands, Jamin Wade, News 19 WLTX.